Hello, my name is Tonoya Sengupta, and I'll be speaking about quality improvement in screening for dementia in patients with Down syndrome. Early onset Alzheimer's disease has an increased incidence in individuals with Down syndrome, especially in patients over the age of 40. Despite increased life expectancy, there remains a lack of evidence based clinical guidelines for adults with Down syndrome. Because clinical judgment remains the gold standard, when trying to diagnose Alzheimer's within this patient population, misdiagnosis is common. Patients with Down syndrome are incredibly diverse as individuals, as well as in their cognitive and behavioral presentations. The diverse symptomology creates a challenge when trying to establish discriminative diagnostic markers for Alzheimer's. This also highlights the importance of creating longitudinal care plans that aim to improve the quality of life for individuals with both Alzheimer's and Down syndrome. Our study aimed to increase dementia screening in this patient population by 45% over the course of 6 months. We believe that screening is the key not only to proper diagnosis, but also to improve the quality of life for these patients. Our inclusion criteria had 3 parts. First, patients must have a diagnosis of Down syndrome. Second, patients were of the age of 35 and above. And third, individuals must be patients at the Comprehensive Care Clinic located at Geisinger Medical Center in Danville, Pennsylvania. For all patients fulfilling study criteria, patients were screened by the Dementia Screening for Individuals with Intellectual Disabilities, or the DSQIID. A positive screen was defined as a score of 20 or more, with a scoring based on new or worsening symptoms. Subsequent chart review was performed via EPIC to confirm age, screening results, and whether screening was done before the date of visit. This was an observational study comparing pre-intervention, which was between January of 2020 and June of 2020, and post-intervention, which was between August of 2020 and January of 2021. Of the 36 eligible participants, 1 was screened during the pre-interventional period. This number increased to a total of 11 participants screened during the post-interventional period. Thus, a 10-fold increase in screening was seen, surpassing our goal of a 45% increase during the post-interventional period. This data is displayed in Figure 1. In addition, 4 patients screened positive for dementia, which is seen in Table 1. Of the patients screened, the average age of participants was 56, thus reaffirming that individuals with Down syndrome often present with early onset dementia. By meeting our study goals, our study reaffirms that early screening by the DSIIQ integrates caregiver input into any fluctuations in behavior, memory, and functional status, while aiming to improve the quality of life in Down syndrome individuals suspected to have a dementia diagnosis. Our study shows that with minimal impact on the efficiency of office visits, timely screening and appropriate workup of other possible causes may help clinicians to improve quality of life via a proper diagnosis. Limitations for our study include a small sample size of 36 patients, with a majority of patients screened being over the age of 50. This inhibits focused analysis of establishing a baseline for what is an appropriate age to begin screening. Additionally, screening based on worsening symptom presentation may exclude patients with dementia, but presenting with stable symptoms. Furthermore, our ability to capture patients at the appropriate time for screening was limited by our short interval of intervention. Continuing this intervention for an extended period, as well as adding another provider's consensus and reassessing the data, would help us see if more patients can be screened at an appropriate time. Thank you.